As an examiner, when we sit and really check your papers, the general objective of all the examiners is कि किस तरह से हम इसको पास करें हम, ठीक है? And I think I'll request Dr. Zafar to give his perception from the examiner point of view के why candidates fail.
Okay, Shabir, little bit listening to the candidate in the present session and many conversations previously with the students, both from AKU and from other institutions. So here is what I would like to submit. Number one, I think there is a little instructions by the institution passed to the candidate by the institution or supervisors what is SEQ and how to attempt these SEQ. It may not be at all the institutions, but I'm making a general comment. Number two, it transpires that candidates do not have their personal study plan. When I ask them, both in-house and outside, what are you reading these days? How you have organized to study pediatric surgery, and most of them don't have. And I think these are two areas where supervisors can help candidate to develop their plan of continuous study. I think preparation for exam is not just 3 months before the exam, just attending a one intensive course, or it's every day, I would say, every day. Every day you read for an hour. Block 1 hour, maybe you have gone home after a busy call, you are tired, maybe hour or half an hour, study according to your study plan. I think when they study the question, they don't try to understand it, what is being asked. So naturally, when they don't understand the question, they don't attempt to understand the question, naturally answer will be accordingly. So number three, time, 15 minutes, I think questions are made with the mind that the candidate should be able to solve them 15 minutes. My attempt in every meeting for exam, and my colleagues will vouch for it, be brief, be brief, be brief all the time. So they don't have, so that 15 minutes may be a very short time for a confused, I would say, overworked or under the stress of exam. So it may pass like that. Number four, I think, Shabir, you have alluded to, they are not focused when they are writing the response. Like we have asked, how would you investigate? They will put everything, I would say, ultrasound, MRI, CT scan, and as Dr. Salim beautifully alluded, चलो कुछ तो जना negative marking नहीं होती, कुछ तो मिल जाएगा ये लिखने से. So they don't write rational, why they are doing it. In this case, we are not asking like a question is on the Hirschsprung disease. We are not asking the various ways of investigating a case of Hirschsprung disease. We are in the question, we are asking, how would you investigate this case? like it's a redo operation, primary operation, I think investigation will be different. I think this will come only if the teaching program is organized in this way. Number two, they have their personal plan of study. Number three, uh, they spend time on the floor. I purposely asked this question to a candidate a while ago, how much time he spent on the floor and what he does on the floor. Every day, start following one patient. Okay, take a history, do a clinical examination, what investigations are being done, ask your faculty why you are doing it, and then follow that patient. So automatically your preparation will proceed in a right direction. So these are my takes, my observations. Remember, these papers are made by the practicing pediatric surgeons. Many of them don't read every day. They are dealing with the practical problems, day-to-day problems. So most of the candidates have more theoretical knowledge than us, close to exam. But problem is just how to apply that knowledge to a particular problem. There is a gap. So in summary, I would request the faculty who is sitting here to develop a teaching program at your institution. Teach your candidate how to attempt those questions, and off and on give them an exercise and check their questions and give them feedback. Number two, candidates should develop their own study plan, and may discuss it with the faculty, and faculty should help them. Number three, when attempting a paper, read the question. Read the questions carefully and pick up key words in the questions, and we will demonstrate in a while, in our next segment of this session, and answer them briefly and to the point. You are all surgeons, okay, and going to be surgeons. So surgeons just cut and sew sometimes. So that should be the way to write something. If you have written a page or 2 pages, cut it to one.